everyone! I want to talk to you today about something that you may have never paid attention to before, but can actually tell you so much information about your overall health and your hormone balance. So what I'm talking about is the colour and the consistency of your menstrual blood. Now, if you've never paid attention to your menstrual blood before, this might feel like a weird thing to start doing, but I can guarantee you that if you start to implement this practice, the information you're going to get about your overall health is so vital. So let's dive on into the 5 different types of periods so you can learn which one you are and what your body might be trying to tell you about your hormones. So, period type 1 is a bright red, vibrant colour. It has minimal clots and it flows very easily. It usually has a consistency slightly thicker than water. Now, if you relate to period type 1, good news, this is the healthy period type. So if you're having this type of period, your body is letting you know that your hormones are in balance and things are working really well. So congrats. Period type 2 is a dark brown colour. Now, this is really commonly seen in the form of spotting, quite commonly in the days leading up to your period and sometimes in the days after your period as well. Now, the reason that it's brown is because that blood has been flowing slowly, which means it gets exposed to oxygen. So if you're experiencing this type of period, what it might be letting you know is that you have low progesterone. So progesterone is responsible for holding onto and maintaining our endometrial lining until it's time for it to shed in the form of our period. So if you're getting spotting in the lead up to your period, it can be letting you know that there isn't enough progesterone to hold onto that lining really tightly so that it starts shedding away a little bit too early. Period type 3 is a dark purple colour, sometimes a dark red colour. Now, this type of period is often very thick, almost syrupy, and it can contain many clots. It's often associated with painful cramps and lots of PMS symptoms like bloating, mood changes, and breast tenderness. Now, this type of period may be indicating that you have an excess of estrogen. So estrogen is the hormone that in the first half of our menstrual cycle is responsible for building up that lining, which we then shed in the form of our period. So we want this to happen, but in excess, too much estrogen can cause that lining to get too thick. So then when we get to the time of our period, there's so much to be shed away. You often have a really heavy and painful period. Period type 4 is a light pink colour and it's usually very watery and light. It may last less than 4 days, and this type of period is letting us know that you may be suffering from low estrogen. So in complete reverse to period type 3, low estrogen means that our body hasn't built up that nice, thick, healthy endometrial lining to then shed in the form of our period. Period type 4 is also really common in scenarios of depletion. So that could be nutrient depletion or being overworked and overstressed. Now, the final period, type 5, is no period or a missing period. So when you've previously had periods in the past and then your period has just completely disappeared. Some of the most common reasons are polycystic ovary syndrome, PCOS, hypothalamic amenorrhea, post-birth control where your hormones just haven't quite balanced out yet, stress, and of course, pregnancy. So now that you know what period type you are, I bet you're wondering what all of those other symptoms that you're experiencing might be trying to let you know as well. Don't worry, I've created a free 3-minute quiz for you where you can find out exactly what not just your period type, but all of those different symptoms are trying to communicate with you about your hormone balance. So I'm going to link that for you guys below. So take the quiz, let me know which type of imbalance comes up for you and if that resonates with the symptoms that you're having. Alright guys, I'll see you next time.